welcome back to another episode of Ahead of the Curve. Today's episode, we're going to be diving into an important topic, which is considerations for individuals who have hypermobility with scoliosis. But before we jump into that, I'm just going to chat a little bit about kind of my recent trip away. I was in Texas and it was a marathon trip, a lot of fun. If you are on my newsletter or follow me on Instagram, you've probably seen some photos and some conversations that I've been having surrounding my trip. I was there first and foremost for my little brother's wedding. He got married in the Fort Worth area, and it was a lot of fun. I got to meet my new sister-in-law for the first time at her bachelorette party, and her whole family. It's a big, vibrant family. They're all from Mexico, and just a lot of fun and very warm and welcoming. And it was awesome to see my brother so happy. And everything went well with the wedding. The only snafu was the place where they had their reception was at a venue. It was the very first event that this venue ever hosted, and the air conditioning stopped working in Texas, and it was disgusting. I mean, the room was pretty small, and there's like about 100 people in there, so like it would have been kind of warm even if the air conditioning was working. And then people were just kind of piecing out early because they couldn't handle it. Like, guys were in their suits, and poor Regina, my brother's wife, she was in her wedding dress, and just they were both sweating so much, and the cakes were sweating, and the icing was like kind of sliding off the cakes. So keeping my fingers crossed for them, and like praying that they get a complete refund, and maybe even some additional compensation just from that whole situation. But overall, everything went so smoothly. And then after that, I spent a couple days in Fort Worth area until the start of a business retreat that I was going on with the mastermind that I'm doing for my business with Krista Gurka. And that was in an area only like an hour and a half outside of Fort Worth. Everything was very fortuitous in the way the timing worked out for me to be able to go to that kind of back to back and already be there. And that was wonderful, getting to meet other female business owners, particularly people who are owners of small boutique physical therapy and Pilates practices and health and wellness practices. So we've kind of been meeting, well, we haven't kind of been, we've been meeting virtually in a virtual capacity for months. And so I've met everybody through the screen, but it's always different meeting people in person and connecting that way. It was nice to kind of be able to problem solve and brainstorm different ideas with each other for your own business and helping other people with their business. And it was just very refreshing. It was nice. And then my final leg of the trip, I went to Austin and visited with a colleague of mine, Mary. She's been on this podcast before, and we talked about some pelvic floor things, that considerations after you have children. So you can go back and catch that episode. And we were brainstorming some ideas for working together and just creating a program for people who have scoliosis, and helping them kind of walk through that whole trajectory of before birth and after, because it can be a scary time and you're told a lot of conflicting information as far as whether or not it's safe for you to have a child at all if you have scoliosis or spinal fusion, to what's going to happen to your curve as a result of having a child. So I want to help create something that makes you feel confident in that journey, because it's possible to have a child and, have success without a tremendous amount of pain and suffering as a result. And then the other colleague that I got to meet was Caitlin Carlson, and she is one of the first people I ever interviewed on Instagram way back in, I think it was 2020. So it's been 3 years, and we've both grown and changed so much since then. It was been so cool to see her grow. She is a professional who has scoliosis herself, and she wore a back brace for about 8 years of her life and can speak from a place of experience from that. And also she is a massage therapist, a somatic therapist, and she helps to counsel people who have scoliosis and walk them through their journey. And she helps to provide a lot of vocabulary for things that we're experiencing or things that maybe we don't even think of. So our conversation was really amazing too. And I interviewed her a couple weeks ago physically, but that episode won't air, I think, until July. So keep your ears peeled for that. And then if you are a member of my small group coaching and you're able to participate in the Q&As, she is going to be a guest speaker at our Q&A for the month of May. So exciting things. I just feel really full and, ready to dive back in and get back into my routine. 10 days is a long time to be away. And, my back, it did fine. Thankfully, I actually forgot my wedges, but I managed to modify things. I used some hand towels to prop, and when I was doing exercises, and was able to go to the gym and kind of keep up things that way. So now that we're all caught up with that, I talked a bit longer than I thought I was going to about all that. Let's get into today's topic, which is hypermobility with scoliosis. I actually have a personal connection to hypermobility and scoliosis because I have scoliosis and I am considered hypermobile. And I grew up dancing ballet. So if you are a ballet dancer or a gymnast or maybe a dancer in general, the hypermobility that you may or may not have, hypermobility is seen as an asset in a lot of those types of activities. The instructors, it helps you to have more beautiful lines, so to speak, in ballet. So they would encourage me to actually stand in my hyperextension in my knees because it created a more beautiful line. And, my flexibility was seen as an asset because I was able to extend my leg up a lot higher without, compensating through the rest of my body. And I know that happens a lot with, other sports like gymnastics as well. So I am speaking kind of from a place of personal experience. And then there's, other ends of the spectrum of hypermobility conditions that I can't really relate to. And we're going to talk a little bit about that as well. So it's important to note that not all individuals who have hypermobility will develop scoliosis, and kind of vice versa. Like if you have scoliosis, it doesn't mean that you're hypermobile. But the presence of hypermobility may increase the risk for developing scoliosis, or it can influence the progression of your curve and kind of impact your management. How you manage your curve looks a little bit different if you're hypermobile versus if you're not. So we're going to walk through some stuff today, and I'm going to kind of take you through a little test in a little bit to determine whether or not you have hypermobility. And, it's just kind of one of many tests that you can take to sort that out. So it's recommended that if you have hypermobility, that you seek out individuals who specialize in hypermobility. There are people that do that. So for instance, that would be like a rheumatologist or even an orthopedic doctor. There's now physical therapists who specialize in hypermobility. If you're on Instagram, there is a girl named the Hyperphysio Kate, and there's several other hypermobility accounts on there. So they're all wonderful resources to kind of give you some support and idea of considerations in addition to some things we're going to discuss today. To better understand hypermobility, let's just start off by defining it and discussing how prevalent it is. Hypermobility refers to an increased range of motion in the joints beyond the typical expected range. So if somebody is able to completely straighten their arm, that's the expected range. If you're watching on YouTube, you can kind of see me demonstrating. Someone that is hypermobile, they are able to go beyond that expected range. So this is beyond expected range. And it's characterized by joint laxity and flexibility. The joints are able to move beyond normal limits. So there's estimates that suggest hypermobility affects approximately 10 to 20% of individuals in the general population. However, this prevalence varies, based off of some factors such as age, gender, and ethnicity. Hypermobility is more commonly observed in females than males. Woohoo! Lucky us. Kind of the same thing as scoliosis is more commonly observed in females versus males. Is there a connection? I'm not sure. Could be. And it occurs in both adults and children. So some people that have hypermobility, they might find that it's pretty benign, that they have it. It doesn't really affect their life. They don't have much pain or discomfort with it. And then others, they experience a lot of pain and discomfort, possible frequent joint dislocations. Also, issues with balance occur a lot with people who have joint hypermobility as well. And there's a couple of conditions in the hypermobility family, such as it's called joint hypermobility syndrome. And then there's connective tissue disorders like Ehlers-Danlos syndrome and Marfan syndrome. So joint hypermobility syndrome is diagnosed when hypermobility is present without significant structural abnormalities or a systemic connective tissue disorder. And then Ehlers-Danlos syndrome, that refers to a group of hereditary connective tissue disorders that are characterized by joint hypermobility, skin hyperextensibility, and tissue fragility. So skin hyperextensibility, that means like if you pinch and pull onto your skin, it stretches beyond what you would expect. So like I'm pulling on my skin here, it's only like coming away from my arm, maybe an inch. I think, if you have something like Ehlers-Danlos syndrome, your skin would extend much beyond that range. And then there's Marfan syndrome. It's a genetic disorder that affects the connective tissues in the body. It's caused by mutations in the gene responsible for producing a protein called fibrillin. I think that I'm saying this right, fibrillin. And that's what provides strength and elasticity to your connective tissues. So with Marfan syndrome, it affects like your heart, your blood vessels, your joints, your bones, and your eyes. So next, we're going to talk about how you can determine if you have hypermobility or not. And one of the common tests for hypermobility that we learned in physical therapy school, I also learned this when I was diving into my scoliosis training. It's called the Beighton score. And the way that this works is you assess different joints in the body and you take them through certain ranges of motion. And then you kind of get some points based off of whether or not you demonstrate something that is beyond normal range. And then that's added up at the end. So we're going to walk through this together. If you are watching this on YouTube, you can take yourself through this. Be gentle. Do not push through pain. Don't go crazy, get cranking on your joints to make yourself hypermobile. And if you're listening to this, you can just kind of imagine what I'm talking about. Or if you're not driving, you can take yourself through this as well, just based off of my verbal description. So the first assessment that you do is passive dorsiflexion of the little finger. So you take your hand and you place it palm down, face down on a flat surface. So imagine I'm on a flat surface. And then either, the examiner or you yourself can do this to yourself. You hold onto the end of your little finger and you press it up towards the ceiling. And if it goes beyond 90 degrees, which mine does, that is considered positive or hypermobile. And you test both sides. Okay, so you get a point for each side. The next one is passive opposition of the thumb to the forearm. So this time you take your hand and you can place it face up on a flat surface. I'm going to keep mine face down just for visual purposes. And you passively take your other hand and hold on to the thumb, and you see if you can press the thumb flat against the forearm, and which mine does. And you can do that on both sides. Okay, so my palm is face down, and then you just gently pull and see if it touches the forearm. Again, a point for each side for that. So far I'm up to 4. And the next is hyperextension of the elbow, which we already saw this if you're watching. So when you are testing for this, you extend your elbow out straight, and then whatever is straight to you. Mine is going about 10 degrees beyond neutral. So this is neutral here. And then when I fully lock out my joint, you can see that it's going beyond neutral. To really get specific with it, you would probably need to use a goniometer, which is a measurement tool, to see if that's actually 10 degrees or not. But generally, if it's going beyond neutral, you would be considered hypermobile, or you would get a point for that one. And then you do the same thing for the knees. I'm not going to demonstrate that. But you stand up and you lock your knees out straight, and you see if the knees bend backwards 10 degrees. And mine do. I might show you this on Instagram this week. I don't know. I haven't decided yet. And if that is the case, you get a point for each side. And then the final test is the forward flexion of the trunk. So you're just standing and you bend forward from the waist, keeping your knees straight, and see if you can get your palms flat on the floor. If you can get your palms flat on the floor, that is 1 point. Okay. So, kind of the way the scale works, if you scored at least 4 points on that scale, then you would be considered hypermobile according to the Beighton scale. And again, this is just one test that's used to evaluate hypermobility in order to get kind of a definitive diagnosis, so to speak. There's other evaluation tools that your doctor might use for that. Okay, so next we're going to talk about exercising with hypermobility. So some considerations for that. I know that everybody's kind of been, if you have hypermobility and scoliosis, or if you just found out that you are hypermobile and you have scoliosis, you're probably wondering, what do I do about it? So when you're exercising, obviously exercising is crucial. If you have scoliosis, we've talked about this quite in depth on this podcast. And then if you have hypermobility, it's even more so important to be exercising in order to build strength. So it just looks a little bit different if you are someone who has hypermobility versus someone who does not. So someone who is already hypermobile, your focus with your exercise and with your training should be less so on mobility and more so on building strength, and also working on balance as well. And then somebody that does not have a hypermobility syndrome, you may want to be focusing a bit more on mobility in addition to building your strength. So one reason that you want to be working on your balance with hypermobility, we've talked about how your joints are really essential to knowing where you are in space. So that's something called your proprioception. And you have these little proprioceptors in each joint of your body that send a signal to your brain to let you know where you are in space. And when you're hypermobile and those joints go beyond the quote unquote normal range, sometimes your balance and your proprioception are affected by that. So it's important to make that kind of more of a pillar of your exercise program, maybe than for somebody that does not have hypermobility and scoliosis. It's important that while you are exercising with hypermobility, you maintain your alignment. So focusing on keeping the hips balanced underneath of the pelvis might be a bit more difficult for you because, again, of that joint position sense, difficulty with proprioception might be an issue. And then you also want to make sure that you're not overextending those joints. So as we saw, as we were walking through the Beighton scale, when you extend your elbow out straight, and lock it out on that joint, you're actually causing some strain to the joint, to the ligaments. Instead, you want to always feel like you have a soft bend in your elbows or a soft bend in your knees when you're extending the arms. So if you're on your hands and your knees for quadruped work, doing some planks, you're going to build some arm strength in a different way than you have before because you have a soft bend in the elbows. Your muscles have to turn on and engage to support you a bit more than if you're just relying on your joints to hold you in that position. Same thing when you're standing or when you're coming up from a squat position. You want to make sure that you have a soft bend in your knees when you're standing and doing any activity. If you're standing with those knees locked out for the majority of the day, it has an impact on the way that your pelvis is being held, which impacts the way that your spine is feeling, and so on and so forth. In addition to the actual ligamentous structures around the knee, it's having an effect on the rest of the body as well. Next, we're going to talk a little bit about, we just talked about how muscle strength plays a vital role in providing stability and support for hypermobile joints and the spine. You can do targeted exercises that focus on strengthening your core, your back, and the surrounding muscles of your joints. So Pilates is a really great way to do this because Pilates is such a mindful practice. You're building strength as you're going through Pilates movements, but you're keeping your entire body in mind as you're building that strength. So you're not doing these really small isolated movements where you're just focusing on bicep curls or tricep kickbacks, excuse me, really small movements. You're combining all muscle groups together and doing full body work. So it's a really, really wonderful form of exercise for somebody that has both scoliosis and hypermobility. Strength training as well is really important. With hypermobility, you want to kind of keep in mind that you're not overtraining or overstressing your joints. It's a lot easier. With hypermobility, we'll get into some warning signs in just 1 second. So there's a couple of warning signs and reasons why you would want to kind of seek a professional for some help. So that would be an increase in joint pain, an increase in joint instability, an increase in joint subluxations or dislocations, and then difficulties with your daily activities. So again, kind of checking in with your doctor, finding a specialist would be really important if this is sounding familiar to you. If you're resonating with some of those things, I would recommend seeking out a specialist. So kind of in conclusion here, it is really important to keep in mind what sort of body you're dealing with scoliosis. Are you a hypermobile body? Or are you a normal body, so to speak? Normal is not are you a person without hypermobility, or are you a person who is maybe hypomobile? So meaning like you're really stiff. All of those things are important information to know about yourself as you're building out an exercise routine for yourself. So, as always, like just kind of learning as much as you can about your condition, about how to best help yourself is really important to be your own advocate, because even when you do find a specialist, you have to understand yourself in order to stand up for yourself when someone is trying to give you instruction and treatment. Thank you all for tuning into today's episode. I hope you found this information valuable and insightful. And remember, your well-being matters, so take care of yourself. And we'll be back soon with more helpful topics. Until next time, stay ahead of the curve.